take it.
Yes,
Let's get in more viewer questions. Dr. Thakkar, someone is asking a question that a lot of us are asking also to ourselves and to our office. Is it time to work from home once again?
For a little while, it would help to work from home because you cannot afford to let your guard down. This guy, Omicron, jumps so quickly from person to person that one person in the office positive, the whole floor becomes positive, as against Delta, where one positive, only 4 or 5 in the cabin becomes positive. So working from home for a short period of time, till as long as this wave keeps rising and doesn't plateau, would be a very prudent thing to indulge in.
Which obviously also means that maybe elections, you have a system in this country now where election rallies are being held with no social distancing. You're telling us, doctor, that you've got to work from home. Our politicians are not working from home, Dr. Thakkar.
You need to avoid gatherings and congregations, whether they are at marriages, weddings, funerals, or even political gatherings. If the law applies to one, it should apply to everybody, for the simple reason that the virus doesn't distinguish one from the other. And you can get a huge surge. So I'm sure prudent thinking will prevail and there will be distancing or melting away or smaller numbers for everything put together.
The reason I'm asking you this, Dr. Thakkar, is our next question, which is, are outdoor events safer than indoor ones? I mean, politicians are telling me, look, we are in large rallies, we are outdoors. They are not as dangerous as indoor events. Is there any basis to that?
Obviously, if you're outdoors in a large surface area with adequate distancing and there's good breeze, the chances of the virus hitting you and moving from one to the other is much less, as against to an enclosed room where 5 or 7 people are in a 10 by 10 room and they're breathing the same air with less ventilation. So open air is definitely less. I think the government has already restricted the number to either 50% its capacity or even 25% its capacity. And I know the Maharashtra government is looking very seriously at imposing newer norms depending on the numbers.
So even if I'm having my children's wedding in this month of January, preferably outdoor, not indoor, am I correct?
I think so. That's better if you want to have 40, 50 people.
Okay, interesting question, Dr. Kumar. Could Omicron also lead to long COVID? During Delta, we discussed about the impact that Delta was having on people a couple of months after they'd recovered as well. Could it lead to long COVID? Is that a concern, Dr. Kumar?
Well, Rajdeep, if the question is, could it be? The answer is, it might be. But as I said, it's early days. We are in the very beginning phase. You know, Rajdeep, when this second wave started, when Delta came, at that time, in the initial few months, nobody talked about long COVID. At that time, we were only talking about COVID and its problems. But it's only when the numbers increased and a few months passed by that this entity, long COVID, started being recognized. And we also recognized later that it need not have been always a moderate or severe infection. Even mild infections sometimes lend to long COVID kind of symptom. Right. So same way, whether Omicron will lead to long COVID or not, I think we need to wait for few more weeks before we can answer that categorically.
Vijay Kumar is asking a question, Dr. Rao. My friend is in the US, has taken 2 doses of Covaxin before he went. Should he now take Pfizer or other booster doses available there?
So currently the US CDC recommendation shows that they are allowed for the 3rd dose and they are allowed for mix and match. So now there are clear guidelines that they have laid out. So it is not, I think they are allowing choices there. So what I would suggest is, I think the healthcare centers there would guide him appropriately based on his necessary proof of certifications that he shows to do what is the next step for the booster.
Can I though ask in the Indian context, I think I asked you this earlier as well, but I want to categorize some kind of answer because a number of people are saying, should we be taking Covovax as our booster in India, given the fact that I've taken 2 doses of Covishield and my options are limited in the Indian context? Is Covovax the booster dose that we should be looking at?
See, currently, like I broadly said in the previous discussion also, heterologous vaccination data out there is emerging slowly, which means mix and match doses. Now, all of these are based on phase 2 trials that are being done between 2 or 3 companies showing comparative data, which is showing reactogenicity and immunogenicity for combinations are different. So, which means if I use Covovax and Covaxin, it's going to be different. Covishield and Covaxin is going to be different. So, each particular combination has to be backed up by some relevant data that should allow this thing to happen based
Right.
on the proof that has to be presented to DCG. As of now, no such data has been presented and we don't know of any data in the public domain. So it is not advisable to do so